Back now on Triad Today, and a special guest returns to us. I'm so glad he's here. Jay Paul, our director, if we can meet Dr. Jason Huff. He's, of course, with Emorywood Hematology and Oncology, a Cornerstone healthcare practice. Dr. Huff, how you doing?
I'm doing well, thank you.
Good to see you. We're going to talk about sort of a general topic of dealing with cancer, and there's so many facets to it. But are there any new preventive measures that we should know about when it comes to cancer and trying to prevent cancer nowadays? It seems like there's always something in the news. Have you got anything you can tell us?
Well, I think there's always a lot that we're investigating, looking to try to prevent cancer, but we really have to think about the big, most prominent killers of people today with regards to cancer, and that is going to be lung, breast, and colon in women, and really prostate, colon, and lung in men. And so when we look to try to think about what we can do to prevent that, it's about recognizing symptoms of these diseases, following up with primary care providers for cancer screening, and then really avoiding those things that we do in our everyday lives. Maintaining a healthy weight, exercise, avoid smoking.
Because there's some common denominators there, even though breast cancer is far apart from prostate cancer, and yet if you don't smoke and if you don't do certain things, you've got a better chance, is what you're saying.
Right.
Are there any new diagnostic tools or protocols that can increase chance of survival for people that do have cancer? Anything that's come up since in the last year or so?
I would say the one that really is getting more buzz is screening for smoking or for lung cancer in patients that are active smokers. For the longest time, physicians would often get annual chest X-rays looking, just in those patients who were heavy smokers, long history. There's more data to support the use of low radiation CT scanning in cases of patients who have, say, a 30 or 40-year history of smoking. Survival does seem to be improved in those as cancers are detected earlier.
A CT scan rather than an X-ray.
That's correct. Well, it's a special kind of X-ray. It's a more detailed, unfortunately more expensive X-ray. But the worry you always have with any X-rays are the radiation exposure you get.
Yeah.
So that may be something that becomes more integrated now.
What about any new medications that you anticipate maybe coming along that can be prescribed to treat cancer? I hesitate to use the word wonder drug or miracle drugs, but in reality, anything coming along that you feel good about?
Well, 2011 was a good year for drugs. We have 2 new drugs for prostate cancer, 2 new drugs for melanoma, which is a deadly skin cancer, a new drug for lymphoma. We have several new drugs for breast cancer. So we did a lot in 2011. I can't say we, but as a medical community, people are living longer because of these drugs. I think what we're going to see in 2012 and beyond is more of a drugs directed at what makes cancer cancer. The chemotherapy, the nausea, vomiting, losing hair, where you sort of have to harm the body to harm the cancer. We're going to start to see less and less of that in more directed therapies. So we could talk about specifics, but it would probably be a little beyond the scope.
What do you mean when you tell somebody that you need to manage your disease? Somebody has cancer, very, very quickly. What do you mean that by managing it?
Well, unfortunately, we can't cure all cancers. Some people come in and they have cancer that is beyond our abilities to cure. And so we use medications like chemotherapy, like some of these new directed drugs, to help control symptoms, control the disease, prolong their life, improve their quality of life. So in that case, we hope that in those patients that can't be cured, that we can manage their disease in a way that they can live a life like they might live if they took their blood pressure medicines, diabetic medicines.
And speaking of quality of life, before we run out of time, let me just, you brought up a moment ago that people are living longer because of that and surviving longer, thank God. Are there more and more resources available, support groups, support resources? What about that?
Right now, survivorship is a big issue for us. As medical oncologists and as a cancer community, I think you go through treatment and you're done, and then where do you go after that? And so we're trying to integrate those survivors into active treatment for new patients. And so we're, my partner, Dr. Chinnasamy, has come up with a program called GPS, basically. It's Guideposts of Strength, where we're looking to take people who are survivors of cancer, bringing them back to help new diagnoses.
That's great. On screen, you can see www.cornerstonehealth.com. And you can see Dr. Jason Huff at Emorywood Hematology, Oncology, a Cornerstone healthcare practice. Doc, thanks for being here.
Thank you very much.
All right. We'll be right back.